What diseases were most common due to WWI trench sanitation? Imagine living in muddy, flooded trenches with little fresh water and poor hygiene. It was a tough environment that led to many health problems for soldiers. During World War I, the terrible sanitation conditions in the trenches caused several diseases to spread quickly. One of the most common was trench foot. Soldiers' feet would stay wet and cold for days, causing swelling, blisters, and numbness. If not treated, it could turn into gangrene, which sometimes meant amputation. Because changing socks was hard in the muddy trenches, this problem was widespread. Another disease was trench fever, caused by bacteria called Bartonella quintana. It spread through lice that infested soldiers' clothing and skin. Soldiers with trench fever had fever, headaches, and muscle pain, and it kept them out of action for weeks. Poor hygiene and crowded conditions made lice infestations common. Dysentery and other diarrheal diseases also spread fast. Soldiers drank contaminated water or used dirty latrines, leading to stomach infections. These illnesses caused severe dehydration and weakness. Typhoid fever was another serious bacterial disease. It spread through contaminated food and water, causing high fever and intestinal problems. Although better water purification and vaccines helped reduce typhoid, it still posed a risk in the insanitary trenches. Battlefield injuries could also lead to gas gangrene. This deadly infection happened when bacteria entered wounds contaminated with soil. It caused tissue death and could be fatal without quick treatment. The muddy trenches and frequent injuries increased the chances of this infection. Soldiers on other fronts also faced diseases like malaria and sandfly fever. These were transmitted by mosquitoes and sandflies, especially in warmer regions. Overall, the harsh trench environment made hygiene difficult. Soldiers tried to stay dry by wearing dry socks and applying whale oil to their feet. They also used chemical water purification, even though it tasted unpleasant. Regular foot inspections helped prevent some problems, but disease remained a constant threat. These illnesses affected soldiers' health and slowed down military operations. Despite efforts to improve sanitation, the conditions in the trenches made disease a persistent challenge during the war.